Welcome to our session, Lessons and Challenges from the Review of the WCB in British Columbia, the New Directions Report 2019. I'm your host today, Steve Mantis. The BC government recently released the report, the New Directions Report of the WCB Review 2019. In March of 2019, the BC Minister of Labour asked Janet Patterson to undertake the review of the Workers' Compensation Board in British Columbia. They were also to engage in wide public consultations with stakeholders and injured workers. As the reviewer, Janet Patterson engaged an experienced workers advocate, Jim Parker, to assist with the consultation, research, and writing that this review required. Today, both Jim and Janet are here to present some of the findings and lessons from this review experience. Janet is a retired labor lawyer with 20 years experience in the compensation system and as an appeals adjudicator and a lawyer representing injured workers. Jim has over 25 years experience in both occupational health and safety and compensation system. He's been a workers advocate for both a private sector and a public sector union. Both Jim and Janet have strong interest in the WCB policy and the impact of the compensation system on injured workers. Welcome, both of you. Janet, I'd ask you to kick us off and tell us a little bit about your review and the terms of reference and where you went.
Thank you, Steve. It's a pleasure to be here. The review started, as many compensation matters do, with deep historical roots. In British Columbia, in 2002, there were dramatic changes to both the Workers' Compensation Act and the compensation system. They largely rose out of an employer lobby to the government of the time. And the nature of those changes both cut back benefits to injured workers, but also transformed the compensation system into an insurance model with an employer-dominated governance system. Over the years since then, there have been many efforts to address the problems that that system provided to injured workers, but most importantly, to seriously injured workers. They were the ones left behind by many of the compensation cuts and changes. The review arose because of the advocacy of many advocates, including in labor and outside of labor, for injured workers, and also the large number of complaints that were made about the outcomes for seriously injured workers to the provincial ombudsperson, to MLAs, and to the courts and to media. So it was really no surprise that a review was needed after the 18 years since the last review, but also because the system did not seem to have serious flaws. So the terms of reference were presented to me in this form, that it was to be a targeted review of the compensation system rather than a complete or systemic review. The review was to assess compensation policies and practices around return to work, look at modernizing WCB culture to reflect a worker-centric delivery system, improve case management, and also recommend specific steps required to increase the confidence of workers and employers. And this was to include a fair practice office, and in a basket clause, identify other urgent compensation issues. All of these matters were to be reviewed through what was called a GBA plus lens. The GBA plus lens should be explained, as it was fairly new to the compensation system. This is an analytic process to look how different social groups experience policies and programs and the impact of these programs on diversity, and particularly on discrimination and employment barriers. It started out of the Employment Equity Acts, really focused on gender, but now includes a wide range of disadvantage related to age, sexual orientation, immigration status. And the review was asked to consider all of these things in its general approach. So one of the other aspects of the terms of reference were that engage in wide consultation with the public. We did this through 3 mechanisms, and I think Jim Parker will speak more to some of the details. But we held public hearings. There were 21 days of hearings through 14 locations, and we heard from a large variety and number of injured workers and their families, as well as from unions and employers. I must say this was a very moving and profound experience. The presentations were all 20 minutes and recorded digitally, but workers were prepped prior to their presentation by our admin support people who were very professional, and many prepared days, weeks ahead of time, practiced, drove long distances to present their recommendations to the review. We also had online written submissions, and in a new variation, had a questionnaire that people could fill out, and over 2,000 questionnaires were returned. One of the challenges we had, even though this was supposed to be a targeted review with a limited time frame and limited resources, was these areas actually required a very broad consideration of how the compensation issues impacted injured workers. And particularly the public consultation system was like ripping a Band-Aid off. So many people had so many things they wanted to say, and had not been able or had a forum to say them, that we had a very fulsome presentation. The other aspect of the terms of reference were that required us to modernize compensation. And there really had been a changing definition or approach to disability from the historic roots of the compensation system and industrial accidents. Today, the widely presented or considered use of disability defines disability as both a social and a medical issue. Comes around from the interaction of barriers with people with impairment. And these definitions are taken from the Federal Accessibility Act and the United Nations Conference on the Right of People with Disabilities. This needs to be imported into the compensation system. The other aspect we looked at was how to define a worker-centric compensation system. And fortunately, prior to the review, there'd been a review by Paul Petrie, Restoring the Balance, and he'd given a definition of a worker-centric system. And it really puts the worker and the worker's individual circumstances and needs at the center of policy and treatment decisions. And it's really that simple. One of the ways that we looked at putting the concept of biopsychosocial concept of disability into compensation was to recognize that by recognizing a wider definition of disability, it required a culture shift in the return to work process itself. And that is that you had to give the worker agency, you engaged all the barriers that affected a worker coming back into employment, and you had a consultative and agile system for dealing with issues around barriers. This was in contrast to the current case management system, which was both adversarial and time-consuming and focused around entitlement. In fact, the whole worker approach was looking at putting it into the case management system as a whole. Another important aspect was that we had to look at the institutional the way disability is defined institutionally in the compensation system. Currently, right now at all levels, disability is talked about and defined as time on wage loss, and reducing disability is considered to reduce is measured by reducing time on wage loss benefits. To that end, a success is defined as reducing benefits. And this is tracked statistically and in terms of managerial performance, right from the highest level down to the case manager. So a broader definition of disability means having to change those institutional definitions and measurements of success. Finally, The looking at a worker-centric compensation system, we had to look at the way the current case management system does not consider or allow individual circumstances. The information we had from extensive consultation inside the board is the way that now when a claim application comes in, there's a diagnosis-based guideline embedded in the claim file set with milestones for treatment and return to work guidelines. This means that managers who are wedded to those milestones do not always welcome or consider additional information either from workers or from the medical community, and they are required by the management system to move the case along. This combined with the institutional pressure to reduce the days on wage loss means that there is really a tremendous pressure on individual decision makers to basically implement a cookie cutter approach to injury and disability rather than consider individual workers' circumstances. And this is justified broadly by the concept of average justice. That is, that the system in using statistical treatments and return to work guidelines will approximate a justice, provide average justice, and that is adequate decision making. In contrast to that, the new directions report recommends that we have essential elements of a worker compensation system, effective, respectful communication, more agile communication, including email and plain English decision letters, but also that decisions are based on the merits and justice in individual circumstances. I've asked Jim to speak to patient-centered medical care, which is the third and an important part of a worker-centric system. Finally, I would like to address the issue of stigma around disability and how to change compensation culture. Stigma is really about treating somebody as lesser and because of disability. And this is unfortunately an overwhelming experience of particularly seriously injured workers through the compensation system. Why is that so? We first looked at the insurance model itself. It's often experienced as dehumanizing by injured workers who focus only on the particular injury and return to work issue timeline, not the whole worker. And the system itself is impersonal. It defines case tax. Even complex cases are passed around a number of case managers who may or may not be familiar with the workers' efforts and needs. But also many workers report a change in case managers' attitudes, even overt hostility, if they don't recover or return to work according to the guideline milestones or as expected. To get a change in the way that is experienced by injured workers, you have to give decision makers permission to consider and allow for individual circumstances. As long as they are under a strict guideline of how to decide cases, you will likely have this attitude towards workers who cause them to run over their expected guidelines. The other thing which we had to address particularly was a general ethos within the organization of a moral hazard. That is the view that compensation benefits actually promote disability and have a negative role in helping injured workers because it makes them more dependent and more disabled. This view is not widely held outside of compensation, and it is puzzling and stigmatizing to many workers, but it is a view that is prevalent within the organization. We went back to policy papers in the past, but also had anonymous input from many frontline workers, and it supports them in their view that they should their role is to kick workers off benefits. This will be a very hard issue to address culturally, but I think one of the key elements to doing improving that is putting a statement of purpose into the Act. We made a number of recommendations about how to support an ongoing worker-centered culture that included a code of conduct in treating workers and employers with respect, and providing an independent fair practices office that had a mandate both for systemic change and for public reporting, and that was enshrined in the Act. But we also need have leadership with accountability and an oversight mandate, and fulfill a stated purpose in the Act itself. Finally, I would say that with respect to the GBA plus analysis, that we found many workers were at a disadvantage within the compensation system itself, that there wasn't a culture of accommodation or help. We've recommended navigators and assistant with language and literacy and digital literacy issues, and that in some cases, particularly with concussions or cognitive impairments, that there be additional supports to actually pursuing and having a compensation claim. There's many more issues and specifics, but that was our attempt to address some of the big picture matters that were required by the terms of reference for the review.
Thank you so much, Janet. You know, your review really ties in well with our national strategy on disability work, basing it on the UN Convention on the Rights of People with Disabilities, the GBA plus lens, the worker-centric piece, and the whole worker approach are all fitting in very nicely. Jim, can you tell us a little bit about the review, some of those dynamics, and some of the recommendations coming forward?
Thanks, Steve. I'd be very happy to discuss this with you. The consultation review process, research process, was really dynamic, and it was quite comprehensive, given that this was supposed to be a focused review with a 6-month mandate. It was quite a large task to accomplish, and we worked very hard at this. And when we take a look at what we did to start with, one of the things that first happened was to review all of the previous WCB reviews. And this started right from Meredith in 1913, the Meredith Report Foundational, and it went through all of the previous BC Royal Commissions. There was a number of them. They happened about once every 10 years up until 1999. So there was a number of those. It was a good learning experience to go back and look at those. There's things that you miss and don't really understand in terms of the concept of what happened. And so that was a very good exercise there. When we get to 2000, just after the last Royal Commission, the Guild Royal Commission that presented its report in 1999, that was in the process of implementation, legislation being developed, when there was a change in government, and the government here in BC decided to conduct a review with a single reviewer, and it did not have a mandate to broadly include participants in the system, stakeholders in the system. It took a very narrow and focused look at stakeholders. And as Janet mentioned earlier, this was the winter core review, and it fundamentally changed the workers' compensation system here. And so we've really been dealing with what those changes have happened for the last 10 years. Currently, there'd be the 2 reviews that had happened just prior to this one. Paul Petrie's review and looking at a worker-centric focus was one of those that really set out a lot of the groundwork for what we did here. And also there was a report on the unfunded liability by Terry Boijo that was very much a technical report to take a look at what to do with the money that the board had accumulated here through savings on workers' benefits over the last 2 decades almost. Those reports really set out some parameters of where we went, and they were foundational on that. We also took a look at other review processes. Interestingly, one of those other review processes was in our neighboring province, Alberta, where they did a very comprehensive review about 2 years before we started on ours. We didn't take the findings from there, although they were very interesting and took a similar focus. But what we did is we looked at what they did for the process, on how they did their research, how they gathered information. And we talked to people from that review, and they were very helpful in telling us how they did some of the different processes, in particular online surveys, which was a big help to us. And they also gave us some advice in terms of other processes for consultation, which we took to heart and found that very helpful. There was also research on current workers' compensation systems, and it was quite comprehensive, and that's been put into the background information that comes with the New Directions report. That's the background into it. And there were 175 indexed items in that research, taking a look at all sorts of studies that were done on the system here and abroad, and taking a look at changing nature of work, all related to workers' compensation system. So a very thorough look at that. Another part that we had for gathering information was to have information requests to WorkSafeBC here in BC. And WorkSafeBC provided us with a liaison, Rhonda Trudeau, who was very helpful in gathering what we called IRs, information requests, that came from the board and looked at a number of different areas. One of the areas they looked at were interjurisdictional comparisons. So we'd have interjurisdictional comparisons on all sorts of issues, such as codes of conduct, what's the particular legislation in different areas, mental disorders, the whole range. It ended up that we had 106 IRs there, and they started from April when we started this, and they went right through until about nearly the last week of what the review was working on. So they went all the way through the process, and just a tremendous amount of information. After we gathered the information, we started talking to stakeholders. And the stakeholders, the standard stakeholders, are employers and labor groups or worker representative groups. And of course, we had a number of meetings with those groups. They were arranged, and discussions with them on focused issues, on what they saw as important matters. There was also a number of internal discussions with WorkSafeBC. Senior management with directors in different areas, disability awards, vocational rehabilitation. We had a wide gamut of discussions with the board. There was also consultations with frontline staff. There was an ability for staff to give anonymous input to the review. And we also had arranged a few workshops with different types of staff that were arranged through the Compensation Employees Union that Janet and I conducted with those staff groups, which are also very helpful and informative. So we talked to those groups. There was some discussion with the medical community also. And when we had a discussion with the medical community, one of the very interesting things we learned was that they felt out of the loop and that they were not communicated with very well. Doctors would talk about how they would put on the reports that that they would like to talk to a case manager or a board medical advisor, and those requests would just sit there. And if they got responded to at all, it might be 2 months down the road, when there was it was no longer meaningful to have those discussions on medical issues anymore. And so there was a great deal of frustration expressed by the medical community and the treatment community. We talked to vocational rehabilitation consultants that were outside the board and other areas. And so wide consultation there. The most important part, and I think enlightening part of this, was the public engagement. As we said earlier, there was online surveys, and it was nearly 2,000 online surveys that we got back that were mostly narrative discussions rather than there was some analysis done, and it was mostly taking a look at the narrative comments that people had. The public hearings. The public hearings are so important, and it was part of the mandate that there be public consultation. When we started the public hearings, one of the first questions that we were asked by a participant, this was as we were setting up, was, when was the last time this happened? And that was a very interesting question because we thought back to it a bit. The last time that there was public hearing consultation was for the Gill Royal Commission that was released in 1999. And that Royal Commission was never really fully implemented because it was interrupted by the Winter Core Review. So the last time that there was real meaningful public consultation that resulted in legislation was the Tyso Royal Commission, which was in 1966. And that essentially puts public consultations that engaged the worker community, workers' families, out of pretty much living memory. And so that was a very important question. And then we felt that the public hearings were so important. And we heard tremendous accounts from people. The public hearings were open not only to workers and their families, but to others. But to the large part, it was the workers and the families that came out in numbers for those. It would have been good if we had more time to set up and were able to more widely bring in people and have more time for people to hear about them. But given the constraints that this review had in terms of time and resources, I believe that the public hearings captured about as much as what you could normally expect to capture through that process. And the other elements were supportive of what happened there. There were written submissions, and as Janet said, I believe 175 written submissions, and these were very comprehensive and detailed on a good number of issues and very, very helpful to our process. After all that information was gathered, there was a matter of putting that together and determining what the key points were and what those key points would be for a further round of consultation. This is something that was unique to this review that we hadn't seen happen anywhere else, is where you get through the process and then you bring back in the stakeholders to hear what we found and get further comments. And along with that, when we take a look at this number of different sources that we had for information, there's this concept of triangulation of the information. And basically what that is that where you have multiple sources of information that use different methods, this creates a triangulation situation where you can determine the accuracy of what you're hearing is whether it's consistent or inconsistent by using those different methods. And what we found is that these messages were very consistent, is that we were hearing essentially the same things in the public hearings and the written submissions as what we heard in the online comments. So we have a very high degree of confidence in what we heard and that it's reflective of what's actually going on. And in putting those issues together, there was a review of all these to ensure that there was consistent and taking a look at, do they fall within the terms of reference that were given to the review? And they did. They all fall within the terms of reference. So after putting that all together, the task came to writing and editing. And that was quite a monumental task. And Janet is the person that wrote the things and managed to put them together along with the other staff. And I'd have to really give a high degree of recognition to being able to make very comprehensive sense and a vision out of what was just a massive accumulation of information. And so where does this lead us? There is 101 recommendations, and the recommendations include legislative recommendations, policy recommendations, and operational recommendations. And you can't do everything all at once. When it comes to the legislative part, there's complications on doing that. And it takes time to put that together. The things that can more immediately happen are the policy recommendations, and those have a bit of a process, but the operational ones for modernizing the compensation board can happen quicker. What we found is that complementary to the workers-centric model is that there's a bit principle of patient-based care. And the patient-based care system, there's principles in there that we heard from the medical community and from doctors within the board, really reflect that you listen to the patient and you listen to their caregiver. And this is an element that wasn't happening, and it's entirely complementary to the worker-centric model. And if we followed that along, it would improve the system tremendously. So in addition to that, there was a lack of good information gathered to be able to make decisions on care. A lot of times case managers and board medical advisors were making decisions without input or discussion with the patient, the worker, or their medical provider, healthcare provider. And so bring that into the care, bring that patient-based care in there should improve the system tremendously. Also, we recommended that there be a medical services office that would help to provide independent medical advice and information, opinions in the process that should help both on the case management decision-making process and on the appeal process. And we believe that that would help tremendously, and it would help to bring about a better system. And these are some of the focuses where we think that there should be the priorities. And finally, to take a look at and turn this back to the rehabilitation model, I think of an example of one of the workers, but it happens with so many other persons. A fellow that the board, that vocational rehabilitation consultant, decided that he should be a service writer. And they made that decision without talking to the worker or talking to his caregivers. And they put him on a training on the job for this occupation. And the worker appeared at the public hearing, but he also brought with him letters from the employer for the training on the job that commended him for his hard work, his diligence, but said that he was entirely unsuited to the job of service writer. He was a very hands-on, physical type of worker, and he just didn't have the reading, writing skills. And so it was such a waste and such a detriment that they didn't listen to the worker, and had they done so, they could have identified a better occupation, and they could have focused on something that was more useful. And so that, again, that worker-centric model and patient-based care is just something to follow along on.
Jim, thank you so much for kind of filling us in on some of the nuts and bolts of the review. We now have some time for folks to really engage in some questions and answers, and we really look forward to that, and we're going to turn to that next. Thank you so much.